Hey Super Sports, Dr. Lisa here with Phase 1 week of our Lumbar Rehab program. So with our Lumbar Rehab, essentially when you've injured the muscles of your low back or the discs or the facets or the ligaments down there, the muscles have difficulty contracting and working in conjunction with each other. So you need to retrain all those. So if you've had childbirth or a car accident, definitely time to get started on these exercises. So today we're going to cover 4 exercises of our Phase 1 Lumbar Rehab. Starting out, we need to learn our core strength. So with core strength, most people think rectus abdominis down the front. That is not core strength. Core strength is actually the muscles of the low back, the muscles of the diaphragm along the top, the muscles of the pelvic floor along the bottom, and then on the front are obliques, the internal obliques and external obliques. So those are muscles you need to learn to control and contract first off. When you can control them all and contract them as a unit, I don't want you to think so much as strength, contract them strong. I'd rather have you be able to turn them on and off. So most people get injured when they go to sit down, they go to get in a car, the dog jumps up on them. In these episodes, these patients need to contract their muscles quickly. So we need to start learning how to be able to do that. So step 1 is being able to contract all those muscles together as a unit. Step 2, we're going to have you guys do a ball exercise. Good posture, bad posture. So you sit up nice and straight with your butt out behind you. This actually locks down the spine. So if you are looking to be sitting for a long period of time, this is the best way to do it. This is what catchers do. It protects their low back. So with good posture, we stick our low back out behind us. We contract our pelvic floor. We contract our diaphragm, we pull in our belly button towards our spine, and we contract our lumbar muscles. So that's good posture, part 1. Then we progress to bad posture. We stretched out that low back, we're slouching, we're rounding the shoulders, and we're also pushing our hips forwards. So with this exercise, we go from good posture to bad posture, nice and slow. If this exercise is painful in any way, gently progress into it, letting pain be your guide. I don't want you to push it too far. My patients that have lots of low back spasms, this exercise is great for them to learn how to get that low back to relax. This is actually a type of PNF stretching. Peripheral neuromuscular facilitation is actually PNF. What that stretching does is it takes the muscle from short to long and re-educates that muscle as to what length it should be. And studies show that that is much, much more effective than just static stretching on its own. Okay, so that is the exercise here. That's the first one I'm going to have you do. The next one is the side-to-side ball exercise. Sit up nice and straight on your ball, and then we're going to progress to sitting on one butt cheek and then the other butt cheek. And I want you to pull the opposite hip up towards your ear. So it almost looks like you're hula hooping on the ball, but you are not. And I want your shoulders sitting up nice and straight, and I don't want you leaning them in any way from one side or the other. You're going to feel this right on the sides. It's an exercise for the obliques. And the most common mistake I see with this exercise is patients will actually push their hips out to the side, and that is not what I want you doing. So go ahead and look in the mirror when you do this and make sure you're doing it right. So that's the second exercise. When you have the forward and backs and you also have the side to sides correct, then we're going to progress to hip swivels, which are big circles. And they're actually egg-shaped, oval, and I want the edges to be nice and smooth. So as you're coming around, this is what it looks like. And I really want you to focus on all 4 corners. I want each of them to be nice and smooth, and I don't want to see common errors. One common error is you hit an edge and you turn it into a sharp corner. Another common issue that we have is people will hit an edge and then they will kind of ratchet around that edge. And the third most common error is coming around and just completely cutting the corner off. And usually when people do that, they will rotate their hips, and that is a sign of a muscular weakness or imbalance. So doing these exercises, you're going to train your body, train these muscles to talk to each other, and you're going to train control into them. So be very gentle on yourself. If you don't have it in the beginning, don't feel bad. It takes time, and once you get it, you will have the muscles all functioning together as they were designed to work, and you'll be much less prone to being injured. So, and then the last exercise is opposite arm, opposite leg on the ball. You'll be laying on your belly on the ball, and you have to contract your core muscles before you extend the arm and the leg. So might as well show you what it looks like. So first I want you to pull in that belly button. When you have the core muscles contracted and pulling up the pelvic floor, contracting that diaphragm, then go ahead and extend opposite arm, opposite leg. And you shouldn't wobble. You should be able to sit here for a very long period of time because your body is strong and controlled. If for some reason you do not contract the pelvic floor and you can't contract the diaphragm and do the core strength, you will wobble to the side or else you can fall off the ball, which is what we don't want. Okay, so those are your exercises. Go home and do them, and we'll meet back here next time to discuss the rest of your treatments.